Now you can offer both HMOs through 12/1 or through 12/15. The other thing that they've done is they've enhanced their small group HMO network. So in the past, there was a large HMO network for Anthem, for large group, that included Palo Alto Medical Foundation. And when small group went 1 to 100, a lot of these groups were now dumped into small group. If Anthem did not increase their network for small group to include Palo Alto Medical Foundation, a lot of those groups would have gone to other carriers. So they did go ahead and enhance it. So now the large group and small group networks are the same, and now both have Palo Alto, so that allowed them to retain a lot of that business. When we talk about 6 or more enrolled, prior carrier bill is all you need in lieu of the DE9C. So again, they're making life easy as well for you here at Anthem. The one thing I wanted to point out with you, and we just wrote a group, and this replies to the next one. 5 or more enrolled, all you need is 30% participation. We had a situation, we had a 15-life group. We had 10 enrolled in California, we had 5 in Nevada. The 10 in California went to Kaiser Direct. So the 5, which were out of state, went to Anthem Blue Cross. That situation ended up being a nice win for that employer, because with the situation here with Anthem Blue Cross is you don't need 5 enrolled in California like you do with United Healthcare. As long as you have 30%, we had 51% eligible in California because we had 10 in California in that example. So we met the out-of-state rule, and we had 30% enrolling because we had 5 in Nevada. So that is a great way where if you have a situation like that, please keep Anthem in mind. As we're moving on, individual coverage off and on exchange is a valid waiver. So you are going to take your total head count, subtract off valid waivers, subtract off individual waivers, subtract off exchange, and whatever the remainder is, then you need 30%. So it's very easy to meet participation with Anthem Blue Cross. Some of the other carriers do not allow you to have individual coverage as valid waivers, such as Aetna, so be mindful of that. And lastly, under Anthem, startup friendly. If you have a group, if we want to go ahead and start a dog walking company starting on 10/1, we can have payroll starting 10/1, and we can have coverage starting 10/1. The one thing I wanted to point out to you, though, is there is a website, and you want to write this down. It is called Kepler, KEPLER.sos.ca.gov. That is the California website that will make sure that the business that you're writing is a legitimate business. That is Kepler.sos.ca.gov. Whenever you have a new group that says we want to start coverage effective 10/1, the first question you're going to ask them is, are you set up with the state of California as an active eligible business? If the answer is no, or if they look at you like, what are you asking, you want to show them this site because they have to file legal documents to be an active business. And when they do that, they will show up as active on that site, and therefore now they're eligible to have a group health plan. It's really important that these things don't blow up with you, because we did have a broker that wrote the group, got them all set up, and then realized that they had not even registered on the site yet, so they were not an eligible group and could not have coverage effective the date that they enrolled, which was not a good situation for that broker. So please be careful of that. When we move on to the upper right-hand section of your screen, we're going to talk about CalChoice. CalChoice, again, has become very popular. 10 or more enrolled, all you need is that prior carrier bill in lieu of the DE9C. However, if the variance is more than 10%, you will have to show the DE9C, so be careful with that. And then the commission with CalChoice is the highest amongst any of the carriers here in the group health arena. They're offering 6.5% commissions. That is not going to last forever. All the other carriers are at 5%, and they will be following suit shortly. So if CalChoice is a good fit for your groups that are looking for a Kaiser, non-Kaiser option, this is a great way to go. HealthNet, unfortunately, has struggled this year. We are starting to see the 12/1 renewals come in with double-digit rate increases. So unfortunately, what we're seeing is a lot of movement away from HealthNet. However, they are offering any plans and networks available through November 2017. But again, we are starting to see the HealthNet's the one where you're going to have a lot of activity on this year. So be careful and mindful of that. United Healthcare has been a rock star as far as 2017 goes. They have been extremely competitive. A lot of migration from other carriers have gone to United Healthcare. They have done a lot of things right. One thing is the 10 or more eligible. all the employer is signing is that participation certification form. They do not need that DE9C. So that becomes another help when you're looking where to place a group. The alongside Kaiser rules are very simple. We had a 90 life group here in California. We had 85 of the 90 went to Kaiser Direct. 5, which were the owners, went to United Healthcare. And again, with Cal Choice, you have to have the adjacent metallic tiers. So you have to pick bronze and silver. Oftentimes, the owners want a platinum plan. They're going to go to the best they possibly can. They can write off it all as a business expense. If you go to United Healthcare and Kaiser Direct, you don't have the adjacent metallic tier limitations. You can go ahead and put them on platinum. All the other folks can go over to Kaiser Direct, and your group is just fine. So that's a nice advantage that UHC offers. But again, the 5 have to be enrolled in California. And again, the 1 to 2 life groups, they take a little bit longer than the 3+ groups. We are starting to see a lot of these approvals coming in very quick. So they're coming in much faster than they have in the past. But again, the smaller the groups, they do take a little bit more due diligence on behalf of the carrier, and that's why they take a little bit longer. Now, what is happening in 2018? I'm switching gears on you a little bit. So this is 1/1/2018. And the reason I bring this up is because this is important for you to understand. We are going through a major rating change in January 2018. And what I mean by that is currently, if I have children that are under the age of 20, everybody between 0 and 20 pays exactly the same rate, maximum 3. Now, all of a sudden in 2018, what is changing? What is changing is that if I have children that are between 15 to 20, those kids are going to cost me more money. So the 0 to 14-year-old children are all going to be the same, just like the 0 to 20 now. But as soon as kids become age 15, you are going to be paying more for them, 16, 17, every year that the child ages, the rate will go up. Please make your employers aware of this. They're going to be shocked. They're not going to understand what's happening. Your rates are going to be coming back a little confusing. What is going on here in January? Just want to give you a heads up. This is what's going to change. The maximum 3 is still in effect, so you won't be charged for any more than that, but it's going to be the 3 oldest children is what's going to happen. So again, the big thing is anytime we have an employer who's asking for a census, typically they'll get the employees and they'll say they have 3 kids. And we typically will go ahead and rate them 0 to 20. When you go back and ask for that census for your group starting in January 1, you have to get the dates of birth for the individual children. This is going to be more work on your behalf. You have to be able to explain why to the HR person, and the reason is get the ages, the rates are going to come back possibly higher and create some confusion. So be careful of this. This does not impact your 12/1 rates, only impacts the January 1. And January 1 will be starting to roll out in October. Anthem will roll out October 10th, and some of the other carriers will come out towards the later part of the month. But all your 1/1 rates will be rolled out in October. Now let's talk about ancillary. As now's the time when you're renewing the medical, always include an ancillary quote, because it's a great way to go ahead and really put another tentacle around that group, make sure that they're committed and you're not allowing another broker to come in, providing an ancillary quote, and now they have a foot in the door. Some of the ancillary lines we want to share with you, Anthem has come out with a very nice option as far as ancillary goes. What they're doing is there's no DE9C required. These are very rich dental plans, by the way. 80–90% UCR. They also often offer the endo and perio. And there's no waiting period, which is amazing. So that's a good solution for you. And if you need orthodontia, typically we need a minimum 10. Delta Dental needs 10 for orthodontia. If you need ortho and you need less than 10, all you need is 5 eligible and 5 enrolled with Anthem, and you've got it. So the bundling discounts are also there for you. One of the surprises this year is that Choice Builder has become our #2 ancillary carrier. And the reason is that we always looked at them as kind of a B-tier ancillary player, but now they really stepped it up. By offering Anthem and VSP, they are all carriers in our one umbrella. And so I would encourage you, if you're looking for a very quick, as you're including ancillary on every one of your medical groups, consider Choice Builder. It's a great way to get out there and at least make that offer to your employer group. Delta Dental is still our #1 carrier. They have not had a rate increase since 2013. So for those of you that bought the plan in 2013, you may have overpaid a little bit, but the 2018, still no rate increases. So this is going on from 2013 to 2018, no rate increases with Delta Dental. If you put them on the Premier plan, they never have a problem. We've never had an issue. Most of the dentists are on that network. Always try to sell the Premier plan when you're looking at Delta Dental. Moving on to Guardian, no waiting period, and they offer the rollovers. Some people love the rollover because it just gives them more benefit when they actually need it. That is a feature that Guardian offers that others do not. And we look over at Met. Met has 5% discounts when dental's bundled with one other line of coverage. So again, you want to pay attention to these bundling discounts. Oftentimes they're ignored. It's a great way to bring more value to your employer and to help manage those costs. United Healthcare is another one that we've had a lot of success with. Again, bundling is a key issue here. The dental plan is powerful. The one thing I wanted to point out with you, they have an unlimited dental plan. So if you have an employer that has an enormous amount of dental needs, they can actually go to United Healthcare and get a plan that has an unlimited cap on the dental. So usually when we see dental, we see $1,500 bucket of money in a calendar year. Now you can get an unlimited and a $5,000 annual max. And typically they have, you know, $200 deductibles. But for somebody who needs a lot of dental work, this may be an option. Vision with Costco now is in network, which is excellent, and then LTD is down to 2. So when you're looking for comprehensive quotes, United Healthcare would be a very viable option for you. And then VSP is the same as going direct, very simple, no administrative fees. So we'd encourage you to always add VSP to any of your existing groups. So as you're entering the fourth quarter, and we have seen a flurry of quote activity currently, and that's exactly what you should be doing. Let's talk through what do we need to do now between September and December to really manage the process and to make sure that we are not getting overwhelmed as we're heading into this busy season. In September, you really want to be presenting the renewal options for the 12-1 groups to the extent you can. One of the key things, and this is really unfortunate, we had a broker that lost a group. They moved a group from carrier A to carrier B. They did not get a list of the providers and the medications that the owner was on. When the owner went ahead and went to the doctor and to get the medications, they discovered they were out of network and had a significant out-of-pocket cost associated with that. The owner was furious with the broker and changed brokers. This is one thing I cannot emphasize enough. As the formularies are narrowing and the networks for providers are narrowing, you have to make sure that if you're going to be moving a group from carrier A to carrier B, please make sure that you do your homework specifically for the owner and the owner's family and ask them ahead of time, give me a list of your providers and your medications you're currently on. Here at Beere&Purves, we're very fortunate. We have staff available that will provide a comprehensive review of the carrier that you're going to be moving them to. You will receive a screenshot or a summary in Excel listing the provider and the medications and whether they're included or not. This is a great value add that I would encourage each and every one of you to take advantage of. That way you have the conversation ahead of time. So if we know they're on 6 medications and there's only 3 going to be covered, going to the new carrier, you have to let them know in advance. And then they can figure out, does it make sense to still make the move or not? This is going to be really empowering for you and will help you preserve the account and show that it's enormous value. So please take advantage of that. We have that available. And if you are looking to make a move, go ahead and let Heather or Tracy know, give them your list of medications and providers and the carrier that you're going to be going to, and we'll go ahead and get that search back to you. Also in September, schedule enrollment meetings and gather materials. I'm available if you ever need any on-site enrollment meetings. We also have materials, excuse me, that we can turn around within 24 to 48 hours. We can email the hard copies. Well, we can do a couple things. There's 3 ways you can get enrollment materials from us. Number 1, we can go ahead and put kits together, hard copies, and send those to you or to the group. Number 2, we can send what are called an online enrollment kit. So that way the employee receives a single page, they click on the hot link, they download the application, fill it out, and send it back. And number 3 is we can set you up through eCentral. And all of these are at no cost to you. We can set you up within 24 to 48 hours once you let us know the group, the plans that they're selecting, the employer contribution, and we can go ahead and get that set up for you, so that way that employer can do an online enrollment. Very simple, there's no missing items. And during this busy season, it's hard to track down all the missing items because you're losing time. We would always encourage you to at least talk about eCentral at each of your meetings. And that was the other thing I wanted to share with you. We had a broker that lost a group because another broker talked to them about online enrollment. The incumbent did not mention anything about online enrollment and didn't realize that the broker had access to it through us here at Beere&Purves. We give access to everyone at no cost, and because that was not mentioned, they didn't realize they had it, the broker. So please may offer that and mention that whenever you're going to be moving a group from carrier A to carrier B. Now we're going to go into October. What do we need to do in October? Hopefully you're in a position where you start submitting groups, and then we can submit business through eCentral as well. One of the nice things about eCentral is that if the group was quoted in our quote engine, we actually have the ability to hit a button and it uploads into the eCentral onboarding tool. And then we hit a button and it goes over to the underwriting and really expedites that process, makes it very clean and very simple. So if you have any questions on that, please let me know. We'll take you through the demo so you can see how it works and see how you can present it to your employer and see if they're interested. We are seeing an increasing volume of employers moving to the eCentral platform. I know it sounds a little bit scary, but once they actually see it, they embrace it, and now they're convinced it is going to be a way of the future. And obviously you have groups that are blue collar that may not have access to the internet, and they will always be on paper, which is fine. But again, it's a very streamlined approach that we would encourage you all to embrace as you go forward. Now we're into November. So when you're submitting groups in October, one of the questions that comes up is, well, I'm not moving until December. I'm giving you a check for $5,000, moving 12-1, but I still have to pay my October and November. I can't have you cashing that check because I don't have that amount of money to handle 2 months premium and doubling up. The carriers realize this, so what's happening is once you give them the check in October or September for a group renewing in December, they will hold on to that check and not cash it. So make sure your employers are aware. Rest assured that they're not going to get hit with 2 hits to their account coming out in a month. So that money will be held on standby until the 12/1, and then they'll process it at that time. Moving on to November. Once you hit November 15th, it will become gridlock. And what I mean by that is that just like traffic happens on rush hour, everything will come and slow down because everything's being submitted at the last second. It will take longer to get approvals. And again, you want to advise your group, please make sure that you go ahead and get your medications topped off, because depending on how many groups are moving, it will go ahead and create a backlog. And that's why we can't emphasize enough, please try to get the groups to move earlier. It allows for a much happier holiday season as well. They're all done, they're in the system, and we're all set. At this stage, people take a break and relax. And we really want to encourage you to run through the finish line, because in December, what we're finding is that because of the activity, we call it the I Love Lucy chocolate belt, where the carriers are going as fast as they possibly can, and unfortunately mistakes are made when you're moving at a high rate of speed. We are seeing problems with the wrong primary care physicians. The names are misspelled, the employees are on the wrong plan. We cannot emphasize enough, please make sure that you audit after the approval, the bill, and the information provided to make sure it's all correct. The carriers are getting a little bit tougher about retroactively going back months down the road when they finally realize that they're all on the wrong plan for the last 3 months. So please make sure that's part of your checklist and get that done. Also, cancel that prior coverage. This happens all the time. They forget to cancel the prior coverage. And then in January, once everything is calm, if you'd like, what some brokers are doing is adding, it's called an onboarding process, where a member of our team will act as a carrier representative. They will take them through, and let's say they move from Shield over to Blue Shield, or let's see, Blue Shield over to United Healthcare. In January, we will walk them through how to go onto the e-services, how to do the ads, deletes, how to get their website set up so they can access the online account with United Healthcare, and all of that can be done directly. The broker is always on the line facilitating that, and it's a great value add. So that way the employer can do a lot more and be efficient, and that way you don't have that liability if something gets lost. So that's another option. Please keep that in mind. A lot of the tech companies really appreciate that. So now we're going into the do not forget list. And again, I would encourage each of your offices to have a checklist as you're going through the fourth quarter for every single group, and check these boxes off. Because this is what we're finding are all the hiccups that just create a lot of additional work unnecessarily after the fact. Number one, ask about Cobra and Cal Cobra members when you're switching carriers. These are the lost souls that are out there that are basically unaccounted for, and they surface 3 months later when they realize that the old Blue Shield plan that you had them on and you moved them 3 months ago, their coverage doesn't work anymore. So ask the employer who else is out there from a Cobra, Cal Cobra standpoint, and let's get them an enrollment packet and get them taken care of right up front with all the other employees. Number two is remind the members to get their RX filled. When they submit after the effective date, if you submit a group on 10/5 and for a 10/1 effective date, you're not going to be in the system right away. So a lot of folks struggle that first week. So with appointments and with medications, just make sure to top them off if they're coming in at the end of the month. It just creates a lot smoother transition. As we talked about, you submit the groups in advance. Basically, they'll go ahead and sit on the money for a while, so that way you don't have to worry about that. And then take advantage of the connectivity we mentioned, so that way you don't have to chase down any of these missing items. The generators we're going to talk about in just a moment, which are a great tool when you're trying to figure out are the providers in network, how do these deductibles accrue to the out-of-pocket maximum, and is it Medicare credible? And this is another thing. Each of the carriers do Medicare creditability different. So when you have employees that are over 65 working at your company, and you have and your group size is over 20, is it primary? Is it secondary? How does it work? Is the plan that you're offering creditable, or do they need to be on a different plan because it's not creditable? These are questions you have to be aware of in advance to make sure that there's no surprises after the fact. And we have tools to help you with all of these. One of the things we mentioned was special open enrollment window. And what is this special open enrollment window and how does it work? So when we click on this, this is actually going to take us to exactly what we need to know. So for example, the special open window is from 11:15 to 12:15 for small group 1 to 100. The submission deadline is pretty hardcore. It means you've got to get everything submitted by the deadline of 12:15. Why are the carriers so mean and not accepting groups after that? They are because these groups tend to be those that have a high claim frequency. Because why? As you come down, you'll realize these are the ones that are not meeting participation. So if we are not meeting the 30% participation with a specific carrier, we can go ahead and add them through this wild card, which is through the ACA, perfectly legal to go ahead and put a group on, and all the carriers are participating. Now what happens is, these are the little things I want to make you aware of. What if we have Kaiser in the mix? You'll notice that Anthem Blue Cross says we are not allowing that. So if you have a group that wants Kaiser in the mix going through special open enrollment, you cannot use Anthem. So please be careful of that. You cannot use Cal. As we come down, what if we put a group with Aetna and we only had 10 people enrolling out of 80, so we didn't meet participation? What happens next year? Is it going to be guarantee renewable? Well, the answer with Aetna is yes. So you don't have to be bouncing a group around every year. If Aetna is a good fit, Aetna says, you know, once you're in with us, we will take them and renew them year over year. Some of the others are not going to be as nice, and they're going to audit randomly, and if you don't meet current guidelines, they're going to kick you out. So you want to make sure you explain all of this to the group before you transition them over, so you manage expectations. As we come down, You'll also see, do we need waivers? And a lot of them, it is yes. You will need a waiver for everyone else who's not enrolling. So that way the carriers know exactly how many bodies are out there. These are the other expectations here for groups HealthNet, Kaiser, and United Healthcare. And these rules are here. And so we'll go ahead and make sure that you get these as well when we send this out to you later today. But please take advantage, just talk to your groups. And again, if 12-1 you're running into a problem where a group has not met participation, you want to mention, let's talk about the special open enrollment window, because it is a great solution to a lot of problems. So some of the things we wanted to talk to you about today, again, how do we make you more efficient, or how can you be more efficient, because this is a very time-consuming process this time of year. One of the things that we would encourage you to put into your enrollment kits when you're moving from, let's say, a Blue Shield to United Healthcare, this is a tip. It's called a consumer quick tip. And what does this do? This really gives the employees the opportunity to have a checklist. And what it says quick tips before eligibility. You want to make sure that is your doctor in the network? Are your prescriptions going to be covered? If we have a procedure coming up, do we need to get pre-authorization? These are all the things that create an enormous amount of problems after the fact. So this is a quick list that we put inside of the enrollment kits. So that way the employees, when you go through the enrollment, you go through each of these before the enrollment and they know exactly all the check marks to hit. And you've done a huge value add to the employees to make sure that there's no problem. So now all of a sudden we've done the before the enrollment. So now we're after the enrollment. What are we doing now? So we want to encourage employees to use the member portal. Each of the members, when they go to a new carrier, they can look online, get set up. They can look at information on quality and cost of care. They can look at their prescription drugs. They can look and enroll onto a PPO plan. They can find providers. They can also get their ID cards online as well. They'll look at their formulary. They can obtain the preventive care and immunization checklist. What we're finding more and more, the doctors are adding a lot of additional tests when people are going in for their preventive care that are not covered under the carrier's preventive care benefits. So it's important for an employee, when you go in for your preventive care checkup with your doctor, some will send you the lab in advance to go through it with you. Sometimes the doctor will meet with you, and depending on your situation, they'll check boxes to go ahead and get your preventive care lab work done later, and then they'll review it with you at a different date. What we're finding is that there's a lot of hidden costs, additional costs that are being racked up by the employees that are unaware that these are outside the scope of the preventive care lab work. They have to be mindful of this, so that way they're assuming a financial burden ahead of time. After the fact, it's too late. The other things we want to share with you is how to be a good consumer of medicine. And this is where you as brokers need to tell some stories and explain to them what happens when they make certain choices. Telemedicine is something that we would encourage everyone to do. I've actually had personal experience with this. My son was sick, he had swelling in the throat. We went ahead and took a picture, sent it to a doctor online, and he basically came back and in a live chat over the phone, prescribed it, gave us medicine, and we never left the house. Telemedicine is going to be a wave of the future. It saves you an enormous amount of time. You don't have to wait in the doctor's office for hours, and you get prescriptions taken care of immediately. It's very handy. The other thing that you're going to hear about is something called HEAL, H-E-A-L. Doctors are going to be within a 2-hour window showing up like a plumber and coming to your house, or like the cable person. And if you haven't satisfied your deductible, the cost is $99. If you have, the cost is an office visit. So for those that may have mobility issues, it is really helpful to have a doctor come to the house or your office to be more efficient that way as well. The urgent care is oftentimes overlooked. Here in our office, we had somebody cutting an avocado in our kitchen and put a knife through their hand. They were going to race to the emergency room, which would have generated about a $1,500 bill. Where we're here in Walnut Creek, there was an urgent care center literally across the street. They put basically a napkin over it and duct taped it and walked across, and for $50 they were treated. Now, had it been obviously more severe, they would have gone to the emergency room, but Oftentimes people race to the emergency room for non-emergency related items and end up with a significant charge. And so you need to help people become consumers of medicine. Health insurance is one of the few things that when you go shopping for any other item, whether it be a refrigerator or a car, you know exactly what the cost is up front. Health insurance is simply where you go get services and then you get a bill after the fact. And that's one of the reasons why we see a lot of escalation in healthcare costs. Help your employees become more of a consumer in medicine, and you'll see healthcare costs go down. Also, if you have anybody who's on an HSA plan, please let them know the most affordable ways of getting prescriptions is through Costco and Walmart. That prescription that you go to, say for your CVS, they are all going to be different costs at the different locations that you go get those filled with. So please make sure that everyone knows if you're on an HSA, go to Costco and Walmart. Your medications will be the least costly of any location. So as we come down here, don't pay a bill based on the provider. Always get the bill adjudicated through the carrier coming back to you with an EOB, then you pay. It's always difficult having to unwind and try to get money back. So please let them know how to go about that billing process. And then if you're going to get procedures done, always try to get everything done in advance. Make sure that's pre-authorized. Make sure the doctor's in network, so that way there's no confusion after the fact. So now we're going to talk about some of the online tools, and these are going to be really helpful. So first of all, let's talk about Back Pocket. This is on your website. Everyone has access to this. Right now, we're trying to figure out which carriers are the easiest for alongside Kaiser rules. So we want to go to underwriting, which is here. We want to go to the underwriting, the medical comparison here. So now we're going to click all the carriers. We select all. And these are all the categories you can search by. So you'll notice here that it says participation alongside another HMO carrier, which is Kaiser. We click on that, and then we hit generate details. So what you're noticing here is if I go to Aetna, I need 40% and minimum 5 enrolled, and I need the waivers. If I go to Anthem Blue Cross, if it's 5 to 100, I need 30% enrolled, and I need waivers. Shield, 25% or more. CalChoice, as you know, they don't have that alongside of Kaiser. HealthNet, I need, in this example, I need 50%. And UHC, I can go ahead and need minimum 5 as long as I have 60% between both Kaiser and UHC. I will go ahead and save this, send this to the group if I need to, and now I'm done. Now I know exactly what I need to do to go ahead and get this taken care of from an underwriting standpoint. This is a very powerful tool and very helpful. So please take advantage of this should you need it to go ahead and get that taken care of. The advantages of small group, this is one of the other items that we're showcasing with groups that are typically right around that 100 range. So when you have groups that are 100 or right in that range, oftentimes they think, well, I really need to go to composite rates. I know they're better, it just makes more sense. Groups are always trying to leave small group to go to large group. I'm telling you, sometimes it's a myth. What are the advantages of small group? Staying in small group allows you to have more flexibility alongside Kaiser, as we just talked about. All you need is 5. The trend in a small group is 5% amongst the top selling carriers. Trend in large group is 12 to 15% renewals year over year. So we are not going to be seeing a lot of movement this year from carriers, just to share with all of you out there. You're not going to see the huge movement and migration that you've seen the last 2 years, because if the incumbent is only giving a 5% increase, typically we only see movement when the increase is 10% or more. The employers are going to stay where they're at for the most part this year, which is going to be helpful for a lot of you folks out there. You're not going to have a lot of open enrollment meetings because most of them will stay, and that's an advantage of small group. The flexibility, you can mix and match. You're not getting loaded up. You also have the ability to have the HMO networks are identical. You're getting faster underwriting times, and you're going to get special open enrollments with small group that you don't get with large group. So there's a lot of advantages that you want to educate your groups on. The other thing is, what if you have a group that has a lot of claims? Composite rates factor in the poor health history. Small group, whether I am a chain smoker and I'm obese, I get the same rate as somebody that runs a marathon. It is based on age. So there's no additional load for anybody with poor health, and that's why small group in certain cases can be a much more economically benefit to the employer. So you want to go parallel. You want to quote large, and for those that are eligible for small group, get a small group quote. We've had a lot of success transitioning groups to small group. The other thing is when you look at the rates, obviously the rates are going to be every age they go up. We have a composite rate calculator now. So if you have a group, 60 life group, and the cost is $60,000 in a month, what we do is we take $60,000, which is the premium. You'll let us know what the composite rate tiers look like. So if we have of the 60, we have 40 that are employee only, we have 10 that are employee spouse, and we have 10 that are family. Once we hit that into the generator, it will come out exactly with your composite rate. Taking the 60,000, dividing it amongst those that are employee only, and therefore you can actually provide your employees with a composite rate, even though they are on an age-banded platform. So for those that have questions, let me know. We also have a tool that we can share with you. So this is the important information. And again, we don't need DE9Cs for Aetna for groups 20 or more enrolled, and we only need to sign a participation form for groups with UHC or 10 or more eligible. So those are things we want to make you aware of. So eCentral, we have the ability to put that together. I know a lot of you are familiar with it. I would encourage you to give it a try. It is something that you're going to hear more and more about going forward. We have a team here that can provide you all the resources and to walk you through that process. Everyone that we've done so far has been extremely happy with that process. So give that a try when you have the right group and the opportunity. For those of you that have an eCentral account, you can also go ahead and add Beere&Purves as a partner, and then the enrollment comes automatically to us, and therefore we can set that up for you. Or those of you that have it done at your own agency, you can actually send the group that way as well, and we can get it underwritten for you. Very easy to do. This is taking a lot of time out of the process and freeing up capacity for you as you're trying to go through your 12-1s. The Broker's Pick program. As a general agent, we know you have choices. What we want to do is to be the preferred provider. When you have a group, we want to be top of mind, and for a couple of reasons. We feel we have the best underwriting team out there. We also have a service level that we've really beefed up to make sure that your services and needs are satisfied. And third is we're going to provide financial help to you as well. We know that the commissions are coming under pressure. We know that the margins are getting thinner. As a partner, we're happy to help in those groups that we're partners with you on. We do that a couple of different ways. One is if you have a group that's 1 to 4, we'll provide you with a premium only plan. We have eCentral that's available to you for all size groups, all the way down to a 1 to 2 life group. We'll do the eCentral for you. We also have for groups that are 20 or more, we go ahead and pay any of those items that you see on your page there, the first annual COBRA administration, FSA, ERISA. And if you have a eCentral account for the groups, and you'll see the information right here, if there is 30 life group that we sell with you, we pay you $1.40 per employee per month. So what that means is if you write a 30 life group with us, we have a $540 credit that is paid to eCentral for your account. So that way you're able to go ahead and have a lot less come out of your account going forward. Some brokers, because they write a couple of groups with us a month, they don't pay anything for their eCentral account. So please make sure you take advantage of this. This is going to increase the profitability for your agencies, and it's extremely helpful. So if you have any questions on that, please let me know. The customer generators, these are all customized. We just showed you an example of the alongside Kaiser for the underwriting guidelines. We have medical group networks, so that way if a group needs a specific hospital, you can click in the area and it'll tell you which carriers have that hospital and network. Deductible and credibility status, you want to make sure that you know if you go from HMO to HMO, do I get deductible credit? Do I get out-of-pocket max credit? Is there RX credit? We have a tool that shares all of that with you. So please take advantage of that as well. The partner services are all listed here. We have some brokers that take advantage of a lot of them, some that take advantage of very few of them. But these are all available to you at no cost, especially during this time of year. I would encourage you to map out your process, figure out what of these items that you see on this board ahead of you can be offloaded. And we were happy to do some of that heavy lifting, so that way you can really focus on the analytics and moving groups from carrier A to carrier B, which is really where your time should be spent. We can load groups into the system, and then you can do that fine tuning. And that has worked extremely well for a lot of brokers. The partner services, if you do have a group that is moving from carrier A to carrier B, you can contact either Heather or Tracy, just let them know. There's also a form that's on our website. If you want to fill that out and let us know that the group is moving, this is the information we need. That way it is all ready to go as soon as possible. We want to stay connected with you. We have Twitter, we have LinkedIn, YouTube. These are videos that actually provide best practices on quoting, on eCentral. I would encourage you to look at those. We also have the SMS and emails. So to maintain connectivity, if you're looking for to be up to speed as far as Twitter and those type of things, anytime we have any significant announcement once or twice a month, if you want to do that, please check those spots, and that information will be available to you. Unfortunately, we have run out of time. I want to thank each and every one of you for attending our webinar this morning. If you have any questions for me on any of the content you saw today, please go ahead and email me. The information is all going to be provided to you in an email later this evening with all the content. We wish you the best of luck during the 2017 busy season, and please reach out to us if we can be of any help in any way. Thanks very much for your time. Best of luck. Bye-bye.